So I'm Dr. Christopher Bates. I am a plastic surgeon here at Ponte Vedra Plastic Surgery, and today I will be talking a little bit about what makes up a mommy makeover. So it's a pretty loaded question, but I can kind of give the basics and the general understanding of what a mommy makeover consists of, and who the ideal candidate is, and then of course, kind of what to expect from it. So first and foremost, typically a mommy makeover includes the tummy and the breasts. That's just kind of a general statement for it. And with that includes there are different types of tummy tucks we can perform. There are different breast procedures that we perform, which include things like a breast lift or a breast reduction or even just an augmentation. It's all depending on the patient's body and of course their wants and needs. So an ideal candidate for surgery is a woman, typically who present to me, and we call it a mommy makeover. It doesn't mean you have to have kids. That's just kind of the classic of the people that have had, no matter how much they work out or how many crunches they do a day, they just can't get rid of their abdominal skin laxity or any bulging of their belly because your belly has to expand to accommodate children. This is also for people that have lost a lot of weight in the past. They can sometimes have the same issues. As for the breasts, of course, breastfeeding, classic example. The breasts lose a lot of their volume. They gained a lot of volume during pregnancy, then they lost it and the breasts begin to droop. And most women that are presenting are wanting just a more youthful appearing breast. Some want them larger, some want them smaller. And that's where a lift versus augmentation versus reduction all kind of come into play. So it's different and all individualized for each person that presents. Again, you don't have to have children. It's just called mommy makeover because that's kind of the typical person presenting for this procedure. So with that said, there are different types of tummy tucks. There is a mini tummy tuck where you have a smaller incision. Usually it goes in between your hips, and sometimes that will involve putting together the ab muscles or the rectus muscles, and we kind of tie them together so it gives you an internal corset but also pulls off any extra skin on the outside. Then you progress to things like a full tummy tuck where we actually go all the way up, do the full rectus is again the muscle and bringing it together and then pulling off even extra skin with that. With that procedure, you typically will get a new belly button. So out with the old, in with the new, as I say, and it would give you a nice new sculpted abdomen. Sometimes in conjunction with this, we will do liposuction, whether it be of the hips or the back or the flanks on the side. Again, it's all just tailored to each individual's wants and needs. Not everybody needs it. As for the procedure itself, when done in combination, if we're doing breasts and abdomen, the procedure can take anywhere, from 4 to 6 hours. And of course, that's all variable for each person. When we do an abdominoplasty or a tummy tuck and actually do muscle work, you do spend the night with us. It's a safety thing, and we think it's very important. You stay with a nurse that takes very good care of you 24/7 while you're there. So all patients that are getting muscle work done will spend the night. If they're just getting breast or a mini tummy tuck with no muscle work, they go home the same day. I typically, if we're doing a full tummy tuck, I do use a drain. It's just one of those necessities to help drain off any excess fluid. And as I tell all of my patients, you don't want to get a fluid collection potentially in your belly after you've had this big surgery and during your recovery. So the whole idea is to get a nice, new, slimmer look. So unfortunately, I do use drains, but they're very helpful. And they're usually only in there for a week at max. Again, everybody's different. As for the breast, I do not use drains on my procedures. And depending on the procedure that you have, there are limitations. Particularly if we're doing a primary breast augmentation and the implant is going underneath the muscle, we do ask that you don't do any chest exercises for a total of 3 months. But that's really the only thing that's outside of the normal. For most of my patients, whether it's tummy tuck, breast, kind of any procedure, we follow typically the same protocol. And that is for the first couple of weeks after the procedure, no heavy lifting, and then you kind of slowly advance out of that until you've hit about 6 weeks and you're pretty much free to go. A lot of people ask how much time they need to take off of work. And my answer is, again, that's variable depending on what you do. If you do a lot of heavy lifting and work, well, you're gonna have to take a little bit more time off. But if you're able to sit at a desk all day, most people take off a week at most. For those that are working at home, which obviously is happening a lot more often now due to COVID, I tell them basically as long as they're off of their pain medication and they can conscientiously send work emails and talk on Zoom, then they can get back to work. I've had people where I operated on Friday and they were back to work on Monday. So it's all just very variable per individual, but nonetheless, getting back to work is pretty quick. A lot of questions as well are, how long are my results going to last? Well, again, it varies, but the idea is, a one and done. Obviously, aging and gravity always win. No matter what we do, we can't fight gravity. But as long as you can maintain your weight, maintain a healthy lifestyle, don't get pregnant again. Not that you can't get pregnant after a tummy tuck, you absolutely can, but your belly's got to stretch back out, and as you can imagine, the consequences of that happening could potentially require a repeat type procedure in the future. Which brings me back to the point of it being the mommy makeover. We do typically ask people or ensure that they understand that they are done having children, because again, back to having to do repeat procedures in the future, nobody wants to have to do that. In addition to all this information, we do have a plethora of information available through either our Instagram, which is Ponte Vedra Plastic Surgery, mine is Dr. Christopher Bates, or you can even go to our website at pvps.com. We have tons of information available that hopefully will answer any and all questions.